Hi, this is Dr. Darwin, the new dentist coach, with another episode of Ask Dr. Darwin. Where you ask questions about getting into dental school, getting into residency, and then life after residency and dental school. You can ask those questions here. Send me an email at newdentistcoach@gmail.com, newdentistcoach@gmail.com. Be sure to also subscribe to my YouTube channel, Dr. Darwin Speaks, as I will be posting videos on Mondays, Wednesdays, Thursdays, and also Saturdays. So I don't want you guys to miss those videos. So make sure that you subscribe and also turn on your notifications so you're notified automatically when those episodes drop. So be sure to subscribe also so that you guys can get those videos, like I said, on a weekly basis. Don't want you to miss these videos. So today we have a special guest on the Ask Dr. Darwin show. We have a dentist who has a passion and who's been pursuing oral surgery. He has a couple of questions. Dr. Tyler Smith, where are you at now, Doc? You're in Arkansas, right?
Yes, sir. Little Rock, Arkansas.
Little Rock. So tell us a little bit about yourself.
Well, I graduated dental school in 2015. I was awarded the Dental Student Oral Pathology Award by the American Academy of Oral Pathology. I've always enjoyed surgery since I was in middle school and high school. I grew up around it. My dad's a general dentist that does a lot of surgery. So I spent a lot of my summer and fall breaks riding around with him and getting firsthand experience watching and assisting. And I was always drawn to surgery and pathology while I was in dental school. I just clicked with it, and it seemed like the most fun aspect of dentistry. And when I got out of dental school, that proved to be true. I have a lot more fun doing surgery than I do just about any other aspect of dentistry.
Gotcha. So what are you currently doing now?
I'm a general dentist. I'm the lead dentist for Monarch Dental in Little Rock. So I help mentor the younger doctors that are coming out of school and working with us. If they start a case that they can't finish, I'll try to get over to the office and help them with it, or they'll reschedule the patient to me. And I just work every day just doing a little bit of everything. But I've noticed very quickly that my favorite days of work are the days that I do mostly surgery.
Right. So favorite day, favorite procedure, passion is that surgery that you've shared and that you're interested in. So
yes, sir.
Tell us a little bit about your question and your background as it relates to your question, and what your current plan is, your vision for your career.
Well, I've always been a hands-on person. I've always learned better and worked better hands-on. My GPA, my class rank are not as competitive as I would like. So my question would be, what can I do to set myself apart to possibly get an interview for a residency? I have a significant amount of experience. I would think over 3 years I've performed over 4,000 extractions and over 600 socket preservations using particulate bone. So I would think that would come in handy as an applicant, but I know that the first few things that programs look for are GPA and class rank. I also scored 58 on the CBSE, which I consider that to be fairly competitive. One of my buddies who's a resident got a 56, and my brother-in-law got a 57, and he's a resident as well. So I figured that was fair.
Right.
But I was wondering if there is anything else that I can do to stand out.
Yeah. So your question is, you're in the process of applying for oral surgery currently?
Yes, sir.
Okay. And is
sure am.
Is this your first time applying to oral surgery?
Yes, sir, it is.
Oh, so it is your first time. Okay.
Yes, sir.
So you know a little bit about the process as it relates to others that you know that have taken the CSB. Oh God, I always get that mixed up. CBSE exam. And you know that's a component. That's a major component.
Yes, sir.
You're also right on target with the other components, which is GPA, class rank. But also you got to keep in mind that you are 3 years out of quote unquote school. There's really nothing that you can do to change the GPA, to change your class rank. So you have to look at other external factors that are going to help you get an interview. I do think that your GP experience is good, but it's GP experience. It's not surgery experience. It's not exclusively surgery. So I think, the fact that you've done over 4,000 extractions and over 600, socket preservations, those types of things are great. Have you done a GPR before?
No, sir, I have not, but I would like to do an internship. Obviously if I don't match anywhere, my goal is to apply for an intern and then go and do that. Yeah.
So I think that's one of the things that I might have mentioned or might have sent you an email about, because right now you're in a position though, even though you have experience, which is helpful as far as the GP experience, you still need some more that's going to kind of show your interest, your dedication, and your passion for oral surgery, right?
Yes, sir. Yes, sir.
So that's why I mentioned to you about an internship. And what's nice about an internship is that for 1 year of that internship, every day you are on stage.
That's right.
Every day you're on stage, you get to learn about the program, about the attendings, what they do, but also they get to learn about you.
Yes, so that's what excites me about it.
Yeah. I think if there is anything that's going to really help you stand out, get noticed, get exposure, and get known, it would be that internship.
Yes, sir.
There's many ways to go about it. One of the ways you mentioned, which was I'm going to apply first to oral surgery, and depending on the outcome, I'll do an internship. Maybe if I don't get into the actual program, maybe I can do a 1 year internship. That's great. That's probably the approach that I would recommend.
That was the only approach that I was aware of. I had been told that you could not apply until you had applied through PASS to begin with.
As far as an internship?
Yes, sir.
No,
I thought it just came after.
Yeah, no, that's not necessarily the case. It may have been the program that you looked at. Maybe they had a preference for that. But I have some residents, some GPR residents that are doing 1 year oral surgery internships right now that didn't apply to the program through PASS. They just applied through CV, application, etc.
Yes, sir.
The second thing that's going to get you noticed is that exam score. Definitely that exam score. Even though you've gotten a 58 and you have some colleagues that have gotten 1 point less, 1 point more, you can't necessarily use that as a guideline score wise that kind of locks you in to being okay.
No, sir. I agree. I I just felt better about going into it with something that I felt was a fair score, as opposed to something that I felt was just kind of bare minimum. But I definitely think it could have been a much higher, certainly.
Well, if you think it could have been much higher, then let's get it much higher.
Yes, sir.
AKA, let's take the exam again.
Mm.
I know there's a lot of dedication, a lot of time that goes into preparing for that exam, you know. But I tell you, a 65 looks better than a 58 or a 60.
Absolutely.
You know?
Yes, sir.
That's another thing that's going to help you stand out among other applicants, is a higher score.
Yes, sir.
So I would recommend that in pursuit of getting an interview. And then the third thing I definitely know what's going to help you get an interview is really based on your letters of recommendation.
Mm.
I have a colleague of mine that I sit on one of the boards for DEA, the Council of Advanced Dental Education Programs. And one of the things that I asked him about as far as candidates applying to oral surgery, one of the things that he mentioned was letters of recommendation, but not just regular old letters of recommendation, but more specifically, letters of recommendation from oral surgeons, number one, and number two, from oral surgeons that are known or that program directors know.
Hmm.
So,
yes, sir.
Depending on which programs that you're planning on applying to, you're going to have to do some homework and see where the program directors and your letters of the faculty that are oral surgeons, where they are connected.
Yes, sir.
Because I think that's going to,
okay.
I mean, and this is straight from the mouth of a program director of an oral surgery program in the Midwest. He said, quote, "We like to see letters of recommendation from oral surgeons that we know." End of quote.
Okay.
So that's going to require that you do some networking, which leads me to my fourth tip or strategy that I think will help you get an interview is you got to go to the oral surgery meeting.
Okay.
And you've got to go out and meet some of those people. When that oral surgery meeting happens every year, and I think oral surgery might be similar or different than ortho. I know ortho, they have both a national spring meeting and then they may have maybe like a regional meeting. But the advantage of going to that national meeting is you've got all the oral surgeons from all across the United States that are there. But more importantly, you have all the program directors, probably most of the program directors that are there. And at those conventions, at those meetings, all the oral surgery programs usually have some type of alumni function. Right?
Okay. Yes, sir. Yes,
alumni function where both alums and current OS residents may attend. You need to be right in the middle of that social network, of that oral surgery network, so that you can start meeting people, shaking hands, and putting a face to somebody's name that you've seen online or via a website.
Yes, sir.
You need
a very
to
good idea.
Shake their hands, introduce yourself, and do some Q&A as to what they're looking for. Talk to the residents, feedback from them, because they would have just gone through the same process that you're going through right now.
Yes, sir.
That will help you get an interview, because by that time, residents and the program directors will be able to put a face to your name, so that
Yes, sir.
so that when your application comes across, the pass application comes across the desk of the computer, or they see your picture, your composite picture, your headshot on the application, they're going to be like, oh, wait a minute, this guy looks familiar. Tyler Smith. Tyler Smith. Oh, yeah, remember he came to the reception. Remember we met him? He had that bow tie on that we liked.
That's right. Hey.
You know,
That's a great idea. Absolutely.
So I would strongly recommend that you go to that meeting, and you just need to go on to the AAMOS website and find out when the next meeting is, if there's a regional meeting, and usually those meetings will tell you who's going to be in attendance and if there is some type of alumni function. If you have colleagues that are currently in oral surgery or graduates of oral surgery programs, you need to see if they're going to go to the meeting, and maybe you can be their guest.
Yes, sir.
With that comes the ability for them to introduce you to those program directors. So now you've got a one-on-one direct connection with them.
Yes, sir.
Those are the 4 things that I would recommend to help you go and get an interview.
All right.
Doing an internship, increasing your exam score, getting letters of recommendation from oral surgeons that are known by the program director, and going to that national annual meeting for AAMOS and doing some networking there.
Okay.
Because you got to remember, outside of people getting your application, they don't know who the heck you are, Doc. You
Right.
are one of probably over 1,000. Well, actually, probably close to 3,000 or 4,000 people that are applying for oral surgery positions, and there are not a lot of them.
That's right.
Not a lot of them. So a lot of it's going to be about who you know and who knows you, and getting exposed.
Yes, sir.
So
I do, yeah.
those are the things that I strongly recommend that you look into. That are going to help you circumvent maybe not having a very high GPA, or circumvent maybe not having a very high class rank.
Yes, sir.
Because you got to remember too, most of the schools now, or some of the schools, there is no GPA. It's all pass fail.
Really? I was not aware of that.
Oh my goodness, yes.
No, that's how our national boards were. They were pass fail, but the actual classes, yeah.
That's right, and that's another reason why the CBSE was created, or oral surgery created a separate exam, a spinoff of that exam, because national boards, they used to have a number or a numerical value. It was utilized by program directors to kind of weed through the applications and see, everybody who's 80 and above will take. Everybody else, they get weeded out. We don't even look at their application.
Yeah.
Again, this is straight from the mouths of some program directors. That was a measuring rod, so to speak, that were used by program directors to kind of get through all the applications that they had, so that they can get to the second round of reviewing applications to invite people for interviews. So national boards are pass-fail now, so they don't have that. GPAs for some schools don't have it. It's pass-fail.
Wow.
Class rank. Some schools don't even do class rank anymore.
Wow.
So the playing field is kind of like a slippery slope, which makes it more challenging for program directors to really start being able to determine and evaluate who they want in their programs, or who they even want just to come for an interview. So that's why doing an internship is important. That's
Yes,
why doing that, having a high exam score is important so that you stand out.
Mm-hmm. Yes, sir.
What was your, did you have another question?
Well, that's a lot of good information.
Yeah.
No, sir. I think you answered it all. That's fantastic. Yeah.
So with you being in Little Rock, Arkansas right now, I need for you
Yes, sir.
I need for you to think of and do some homework on those programs that are in the area that you can get access to. Now,
Yes,
I know currently there's not a dental school in Arkansas. I think there's been some talk and some legislation about getting a school, but until that happens, you will have to probably go on the AAMOS website, and that's the oral surgery, or I forgot what it's called, the Academy of Oral Surgery, Oral Maxillofacial Surgery. Go on their website, and part of the website dedicated to oral surgery programs, and you may be able to search it per state and find out what programs are in Arkansas.
Yes, sir. There is I found a list of each state and which programs are in each state, and it went through who the director was, the emails, and how many, it's a 4-year, 6-year, how many applicants they take. So I found that form as well.
Right. Good. Yeah. Good. Because I tell you, if you're really passionate about this thing, Doc, you may have to forego a year of GP dentistry and a year of making some good money to be an intern, which may be a sacrifice in pay, but to be an intern so that you can get the exposure and the credential of having 1 year of internship in oral surgery under your belt so that it'll help your candidacy.
Yes, sir. That's one thing that I am excited about, actually. My brother-in-law, like I said, is a resident, and he did a 1-year internship. And for that year, we'd go to dinner, and he'd tell me, "Oh man, I got to do this. I got to see this," and I'm just thinking, "Oh my good." I mean, he just showed me all these cool pictures, and one thing that I feel very strongly about is that I've got a very strong, very good work ethic. So I feel like if I am put in a position to do an internship, I can show my passion and drive very easily.
That's what you got to do. You got to do it.
Yes, sir.
You got to do it, because right now nobody knows who you are, and no one knows anything about that work ethic. And that's the beauty of being able to do an internship, because it's like a working interview for 365 days of the year.
That's right.
Right? So
yes,
every day is a game day. Every hour on the hour is a game day. Every call that you're taking in the evening is a game day. You have to have your game face on and be ready. And I actually think it's even more challenging than actually just applying to residency programs, because again, as an intern, you are in the midst. You're grinding it out, doing a lot of the work that the first year residents do, but you are there to actually have to prove yourself.
Mm-hmm. Yeah.
Right? So
absolutely.
That's what I think that's going to help you get an interview. Again,
all right.
The numbers look good: 4,000 extractions, site preservation, 600, good board score. But you need more. You need more.
Yes, sir.
Exposure. You need for them to see you, so that they're rubbing up against your shoulder and you're rubbing up against them. You guys are working together so they can see your dedication, your work ethic, etc.
Yes, sir. And I was always curious, I never knew how much they actually looked or cared about experience. So I just thought, while I'm out, I'll do as much as I can just in case. But I never thought that it would be a real big thing that they look at. I've always thought it's kind of, oh, well, that's great, but it's not, it's not this. It's just.
Yeah. Well, every program is different. right?
Yes, sir.
Even more reason, or every program director's vision and interpretation of how the curriculum is going to be delivered is different, which is even more reason why you must go to that meeting so that you can interface and start networking and finding out about what program directors are looking for in candidates across the board.
Yeah.
So
it's a fantastic idea.
Yeah, you got to do it, man.
I absolutely will.
You got to do it. So I'm going to give you a little homework, man. I know you've got a family member that is in oral surgery now, but you need to find at least 2 or 3 or 4 more programs that are in your area or that are close to your area that you can get access to. And quite honestly, I would try to schedule maybe a site visit and go see more about the program. And it's almost like cold calling. You know, they don't know you, you don't know them, and you're just trying to get to an end goal. And your end goal is to make an appointment so you can go see and go visit the program. Part of that end goal is to get yourself exposed so people know who you are, so you're less obscure to them. And the other part of that is so that they can see a little bit more about your passion and your desire for that, so that when your application comes across their desk several weeks afterwards, instead of them putting it in the big pile that gets filed over to the side, it's put over here that gets filed for interviews.
Yes, sir.
That's what you're doing all of this for.
That's right.
You know? Yeah. So let's plan on talking maybe in about 2 or 3 weeks and find out how you're coming along with everything.
I sure can. Yes, sir.
That'll be good. So does that kind of help ease a little bit of your maybe some anxiety or trepidation or concerns about how to get an interview for surgery?
Yes, sir. It has. Like I said, I've always, I've always known that my GPA and class record would be a big hurdle for me. But I've always enjoyed being around people and meeting people. So I would really enjoy going to the meeting, getting to shake hands and rub elbows with these guys, and like you said, get my face out there and get some recognition whenever they see my application and kind of know that they've seen me before.
Right.
I really enjoy that.
Right.
Yeah.
Well, there you go, man. So now's the time. Now's to put the words into action.
Yes, sir.
2 words. Just 2 words you need to focus on. GODO. Go do.
I can. Yes, sir.
Go do. All right. Go do it. Go get it done. All right. So that's good. I'm glad.
Yes, sir.
I'm glad that that's been helpful, man. It's a challenging specialty, but also very, very competitive. Actually, a lot of the content that I've produced on oral surgery is probably the ones that are the most are highly ranked or more viewed. I get a lot of views for people that are looking for information about oral surgery. So it's very competitive. So you have to be able to try to maximize each and every opportunity and advantage that you can get so that you get exposed.
Yes, sir.
All right, man. Well, hey, so glad that you were able to join us. Thanks for that question on Ask Dr. Darwin. Yeah. Hey, and you guys out there, if you guys have questions that you want us to answer, you want to come on and join us, or you want your question to be on our show, again, send me an email right here, NewDentistCoach@gmail.com, NewDentistCoach@gmail.com. Also, be sure to look at the next video that's right over here. That's going to be coming up, dealing with oral surgery. Another video that may help you as far as getting through this process and getting some more pearls as to how to navigate this process. Dr. Tyler Smith, hey man, thanks so much again for your question. Really appreciate it. Thanks for tuning in, and be sure to share this information with other people that you know, but also we're planning on following up in about 2 or 3 weeks. I want to hear about your
Yes,
progress.
sir. All right. Thank you, Dr. Hayes.
Hey, man, you're welcome, man. You take care. Good luck to you, and I'll talk to you soon.
Yes, sir. You have a good evening.
All right, take care. Bye.
Bye.